Hi, how are you all doing? I hope you guys are doing great, and I hope you guys are watching our videos. So welcome to our channel MRCP Made Super Easy. Well, I know we were doing the gastro lecture series, but a lot of people wrote to me and said that they're having a lot of troubles understanding brachial plexus. So we decided to, I would say, do the strap topic on brachial plexus, and then we will go back to our gastro series lecture. Now, before we start our lecture, you have noticed that I have written down three mnemonics over here. Just read it, remember it, and I will tell you how to use it. Now, when we look at brachial plexus, we need to know the extension of brachial plexus. And once you go through my lecture, quite literally, you will be able to remember brachial plexus at the tips of your fingers. Now, why I say that, we will just look at it in a short while. So the extension of brachial plexus happens from C5 to T1. C5 to T1. Now the way to remember it as I want you to stretch your hand out. Your thumb stands for C5, C6, C7, C8, and your pinky is T1. Starting with your thumb, ending with your pinky, C5, C6, C7, C8, and T1. So when you say brachial plexus, you need to know the extension. Now to remember the extension, you have to spread out your hand, start labeling it as C5 from your thumb, end at your pinky, and that's T1. Now once we have known the extension of C5 and T1, I want you to imagine a picture. Now there's this guy, let's say someone like Homer Simpson. Now if you guys watch Simpsons, you would know who Homer Simpson, or you could imagine just any other person. He wants to go out fishing. He's quite bored, so he decides to go fishing, on a hot sunny morning during the weekend. Now this is our guy. Now he's quite tired and he's thinking that, man, if I just had a cold chill beer, I would have enjoyed it so much. So he goes and he wants to grab a beer. Now in order to grab a beer, he has to reach out. So our mnemonic is reach to drink cold beer. Reach to drink cold beer. R for roots, T for trunk, D for division, C for chord, and B for branches. Right, so reach to drink cold beer. Now read roots, trunk, division, chords, and branches. So imagine a guy having a beer, he has to reach out, so that's our mnemonic for today. Now, before we get into the further details, I want you to know how to draw brachial plexus. When you know how to draw, you will be able to answer every damn question that is asked about brachial plexus. Let's learn how to draw brachial plexus. Now, the way to draw it is, I want you to take a piece of paper, write C5, leave some space below, then write C6, C7, C8, leave some space again, and write T1. Have you done that? Well, if you have done that, I want you to draw three Y's, and the Y in the middle facing the opposite direction. Something like this. This is our first Y, this is our second Y facing the opposite direction, connecting the C7, and this is our third Y. So on a piece of paper, write C5 to T1, leaving space between C5 and T1. Then you draw three Y's with the Y facing the opposite direction in the center. And now you draw two E's. How do you do that? Look at this over here. Go in a zigzag fashion, draw two E's. And once you're done drawing your two E's, now draw an X over here, and that completes your brachial plexus diagram. How easy was that? Come on guys, I'm sure this is the easiest way one could draw brachial plexus. Now once you've done that, let's use our mnemonic. Reach to drink cold beer, roots, trunk, division, chords, branches. So label the diagram lateral to medial. R for roots, T for trunk, D for division, C for chord, B for branches, lateral, posterior, medial. These are the divisions of your chords. So roots, trunks, division, chords, branches, reach to drink cold beer. We have used our mnemonic, we have labeled the diagram. Now what? Now, since our guy is drinking a lot of beer, he has this urge to urinate, right? So our second mnemonic for the day, most alcoholics must really urinate. Our second mnemonic for the day is most alcoholics must really urinate. Use the mnemonic, label the diagram. M, musculocutaneous, A for axillary, M for median, R for radial, U for ulnar. And then I want you to connect C5, C6, C7, label it as long thoracic now. Now some of you would say, sir, we don't have a mnemonic for this. How do we remember this, doctor? Well, we do have a mnemonic for that. For those of you who know what bingo is all about, remember they say 5, 6, 7, wings to heaven. Now the reason why they say that is because if you damage your long thoracic nerve, 5, 6, 7, C5, C6, C7, you can have winging of scapula. So say to yourself, 5, 6, 7, wings to heaven, damage to long thoracic nerve causes winging of scapula. Remember that, it's a question and they're going to ask you. And when they ask you, you're going to be ready for it. So we have used our second mnemonic to label. Now let's go one nerve at a time. So let's start with the first nerve, musculocutaneous. Now notice that there is a muscle in this nerve's name. So it is a very muscular nerve. Now why do I say that? Now you'll understand that just in a little bit. So the musculocutaneous nerve, we're going to look at here is the musculocutaneous, the beautiful looking musculocutaneous nerve. Now what is this nerve? How does it run its course? Now it enters into the anterior arm, and the arm says you cannot exit the way you have entered. So the nerve says, okay, fine, I'll just go out through forearm's way. So it is entering into the arm and it is exiting laterally to the forearm. So this is how it enters. Zoom. There goes the musculocutaneous nerve. Anterior arm and laterally exits in the forearm. The motor supply. Now since we are talking about muscle, so it has to do with flexion, right? So the anterior flexor compartment of the arm. Where is it entering from? Anterior aspect of the arm. So the anterior, it is to do with flexion, flexor compartment of arm. Sensory supply, where is it exiting from? Entering from arm and exiting to forearm. So it's the arm and lateral forearm, similar to its course. Now injury to this muscle, since we are talking about muscle. If you want to know if somebody has an injury to musculocutaneous nerve, ask them to show off their muscles. They will not be able to flex their elbow. So if you damage this muscle, you cannot show your muscles. So musculocutaneous, the hint is in the name. Right, so down to our second nerve, axillary nerve. Most alcoholics must really urinate. A for axillary. Now the axillary is, you could see somewhere around the shoulder area. So the course of this nerve is posterior to the surgical neck of the humerus. Posterior to surgical neck. Surgical neck. Keep saying that to yourself because they're going to ask you this, that somebody has come to you with injury to the surgical neck of the humerus. Which nerve is injured? The answer is axillary. Now it supplies the deltoid and the teres minor. Sensory supply, since it is the shoulder, the sensations will be lost in the shoulder area, right? So how do you injure this nerve? Since it is surgical neck of the humerus, you can have a fracture of the surgical neck of the humerus. What will happen? Look at this poor guy. He is shocked. Why is he shocked? Well, he's trying to abduct his shoulder. Abduction basically means taking away. He's trying to abduct his shoulder and he realizes that he's not able to abduct it from 15 to 90 degrees. So he's shocked and he is extremely worried, anxious. He's screaming, oh my god, what's happening? I'm not able to abduct my shoulder from 15 to 90 degrees. So there's loss of abduction. This man would have absolutely had a fracture of surgical neck of the humerus, thereby injuring his axillary nerve, losing abduction. Now what's this? Since he's lost his axillary nerve, sensation will be lost, and this area is called the regimental's batch area. Why? Because when you're in the army, the batch is fixed in this area. That's where the deltoid and teres minor supply happens to the axillary nerve. So damage to the axillary nerve will cause loss of sensations in this regimental batch area. Right, so down to our third nerve, the median nerve. Now this is a V. No matter how many V's you want to connect, you can connect it. As a very, very, very important nerve. Why? Well, we will look at it. You get so many questions on this nerve, not just for the exams, but from the clinical point of view and in your clinic and your postings, your residency, wherever you are. This nerve is very, very important. So we got to remember this nerve. Median nerve, right? This was muscular, this was axillary, median. So it's coming down. So where it's going to go? Course of action. Anterior to the elbow, passes between the two heads of the pronator teres. Motor supply of this nerve? There are two, forearm and hand. So in the forearm, it supplies the lateral flexors of the wrist, and in the hand, it supplies the two lumbricals and the thenar eminence. Now the thenar eminence, TH stands for thumb, so the thenar eminence is located next to the thumb. Which branch of median nerve supplies the thenar eminence? Recurrent branch of median nerve. Now they're going to ask you this, which branch of median nerve supplies the thenar eminence? The answer is a recurrent branch. Recurrent branch, recurrent branch. Remember that. Don't forget. Sensory. Now this is very important again. Now they're going to ask you to differentiate this from ulnar and radial. I do have a description of all the three at the end of our lecture, but let's look at it from now. So lateral 3.5 fingers. Lateral 1, 2, 3.5 fingers. The palmar surface and the superior dorsal aspect. What do you mean by the superior dorsal aspect? It means the fingertips. So say it with me. The sensory supply is the lateral 3.5 fingers, the palmar surface and the superior dorsal aspect of or the fingertips. So that's the sensory supply. Now what happens, when can you injure this nerve? Carpal tunnel causing entrapment of median nerve. You fracture the supracondylar fracture of humerus, lunate dislocation. This is an X-ray of a supracondylar fracture. Just above the condyle there is a fracture of the humerus causing damage to the median nerve. You can have lunate dislocation causing injury to the median nerve, and you can have carpal tunnel syndrome causing damage. Now what happens when you injure? It supplies the thenar eminence, so you could have thenar atrophy. It supplies the medial lumbricals, so you're going to lose your ability to do thumb opposition. Now this is what opposition looks like. You're not going to be able to do thumb opposition, right? Now you can have median claw hand. There are two types of clawing. One is a distal median claw hand and a proximal medial claw hand, and you need to differentiate this from ulnar clawing. Now what's distal claw hand? In distal claw hand, the second and the third finger remain flexed when the patient is asked to open his hand. So distal open, do. Distal, D for D and O for open. So distal open your hand. The second and the third fingers remains flexed. So that's your distal clawing. In the proximal clawing, imagine that you're very angry. Somebody's very angry. They're coming to punch you, but they end up blessing you. So they're coming to punch you, but they end up blessing you. That's what the proximal claw hand looks like. Now what's happening in the proximal claw hand? There is loss of two lumbricals and the loss of muscles of opposition. As a result, you are not able to punch them, but you're ending up blessing them. So that's called the Pope's blessing, right? That's how you differentiate between the proximal claw hand and the distal claw hand. Distal claw hand, the second and the third fingers stay flexed. When you ask the patient to open his hand, distal DO, open your hand. And in case of proximal clawing, you try to punch someone, but you end up blessing them like a pope. So that's the Pope's blessing, right? Now, just for a side note, in case of ulnar claw, the thumb can flex, but that doesn't happen in case of median clawing. Now, let's look at the injuries. Carpal tunnel, entrapment of median nerve due to inflammation of the flexor retinaculum. Now, why does that happen? What are the causes? Now, to remember the causes of carpal tunnel, it's pretty simple. We're going to have a mnemonic. It's called median trap. We are talking about median nerve getting trapped, right? So, the mnemonic for the day is median trap. What does median trap stand for? M for myxedema, E for edema, D for diabetes mellitus, I for idiopathic, A for acromegaly, N for neoplasm or neoplasm, T for trauma, R for rheumatoid arthritis, A for amyloidosis, and P for pregnancy. So that's your mnemonic, median trap. So in order to know the causes of carpal tunnel syndrome, our mnemonic is median trap. Now what can happen? There's going to be numbness, there's going to be sensory loss, and there's going to be atrophy or atrophy of thenar eminence. Right? Simple. So that's going to end our part 1 of brachial plexus. In our second part, we are going to look at the radial nerve and the ulnar nerve. The reason I'm doing this in two parts is because I want you to be able to differentiate between medial clawing and ulnar clawing. And we are going to also look at different lesions of the brachial plexus. That is the Erbs-Duchenne palsy and Klumpke's paralysis. We're going to look at that in the second part. So that's going to do it, guys, for today. And if you think you got something out of today's lecture, then please do like, share and subscribe to our channel so you don't miss out on our weekly updates. And keep watching and keep revising and keep reading. MRCP made super easy. Until next time, take care and bye-bye.